A savior sibling is a child who is born with particular genes that have been chosen in order to treat an older brother or sister who has a disease. It can be difficult for someone suffering from a disease that requires tissue transplants to find a donor. This is because the tissues must match for the body to accept a donation. Donor siblings provide tissue transplants that match their sibling, without the difficulty of finding an unrelated donor match. Human antigen leukocyte, HLA, are cell markers that need to match up donor to receiver for the receiving individual's body to have a higher chance of accepting the donation. HLA compatibility tends to be higher within families because of the greater genetic similarity. Siblings have a 1 in 4 chance of HLA matching with their older sibling. IVF, or in vitro fertilization, is the process by which egg and sperm are collected from a female and male respectively, and combined in a laboratory dish. The resulting embryo is then implanted in the female's uterus. Pre-implantation genetic diagnosis, also known as PGD, is a process by which embryos are tested for genetic compatibility in a specific genotype that does not express a health condition. In pre-implantation genetic diagnosis, the embryo is genetically analyzed to determine its genetic composition before implantation. Embryos are created until a match is found, which is implanted. If the embryo is not an HLA match, it is frozen and saved to be a possible sibling later. In prenatal genetic diagnosis, the embryo is already implanted in the mother when genetic diagnosis occurs. If the fetus ends up not being an HLA match, the parents either have a non-donor child or abort the fetus and retry for an HLA matched child. Hematopoietic stem cell transplantation, otherwise known as HCT or HSCT, involves the transfer of healthy bone marrow or cord blood. It takes 1.5 to 2 years from deciding to conceive a donor sibling to the donor sibling being able to provide a tissue transfer. First, the process of HSCT from sibling donors requires PGD testing to check if the sibling is a match. Then, IVF, which can take multiple cycles, would commence. Finally, the 9 months of pregnancy would precede the vital cord blood acquisition, which altogether amounts to a substantial amount of time. On June 4th, 1991, doctors transferred bone marrow to 19-year-old girl, Anissa Ayala, from her recently born sister. Anissa was dying from leukemia, and her parents chose to have another child to save Anissa's life. This was the first documented case of parents publicly disclosing their choice of conceiving a donor baby. 6-year-old Molly Nash was diagnosed with Fanconi anemia, a rare and fatal disease that causes bone marrow death. Molly's parents chose to have another child, Adam, to become a marrow donor to his sister. The Nash parents underwent PGD and then IVF to make sure the child being born would not have Fanconi anemia and would also be an HLA match to Molly. With sibling donors comes the question of whether the child was conceived exclusively to provide HLA matched stem cells. While many deem using a child solely as means rather than an end immoral, counter-arguments clarify moments in which children are instrumentalized in some form. For example, conceiving a child to be a playmate or companion for the first, or to aid in the loss of another child. Those in support of sibling donors note these motives for having a child are not questioned ethically, and many children are not planned for. They ask why conceiving a child to save the life of another should be questioned. Many question the use of HSCT involving people under 18, or those who are too young or incapable of consent. In these situations, the concept of best interest is applied. Is the act under consideration in the best interest of the person who cannot consent? Those in favor of sibling donors state that it is in the child's best interest that they have a healthy sibling and that their family does not have to face the loss of a loved one. Additionally, the argument of a large advantage outweighing a small disadvantage is used. For example, sometimes a child may move closer to a special school for their sibling with specific needs, which brings a disadvantage from the other child who must leave their familiar school environment. This argument is applied to sibling donors, in which the donor child must deal with the process of tissue donations for the other child to be provided treatment. The experience and relationship of a sibling donor with its family will likely be affected by such a situation. Some worry the child will bear heavy expectations of providing tissue or feel inadequate if they cannot properly provide what they were created for. They may also feel as if their needs come second to their siblings. On the other hand, the child may be proud of their contribution to their sibling or be too young to have understanding of the situation to be impacted. Whether the donor sibling was conceived for that purpose or was already living, they are faced with a no-choice decision if found to be HLA compatible. Donor siblings who are already living will see their sick sibling and feel responsibility towards helping them, while a donor baby's choice is decided by their parents before they are even born. Parents with an ill child will tend to focus their energy on the well-being of that child. If they conceive a donor baby and continue to focus most of their energy on the sick child, the donor baby may feel unwanted, jealous, or unheard. Within the US, federal supervision regarding PGD resides in the FDA, CDC, and CMS, since Congress has not required regulation of PGD. These federal agencies cannot regulate the practice of PGD. Moreover, they can only keep records regarding certain fertility drugs and pregnancy success rates. Clinics have no accountability regarding verifying their data either. As for public views on PGD, its use has been found acceptable to prevent children being born with severe genetic diseases, and also for sex selection if there is a risk of sex-linked genetic diseases. In other countries, the view of family roles within the nation plays a large part in acceptance or opposition of sibling donors. A study comparing views on sibling donors in Germany and Israel was conducted. Due to Germany's past of genetic cleansing in the Holocaust as well as negative attitudes towards people with disabilities, they are already predisposed to hesitation regarding PGD. As for the image of a family, in Germany it is thought of as consisting of separate individuals who together compose that family. These views result in detailed policies regarding embryo selection and a ban on PGD. In Israel, a family is thought of as a single unit rather than a collective of autonomous individuals. In Jewish Israeli culture, showing love for a family member includes doing outstanding things for another, such as donating tissue or conceiving a PGD child. It is also a common view in Jewish Israeli culture to use biotechnology to maintain healthy family genetics to lessen the challenges that may be faced by a disabled child and the family in the future. These perspectives greatly lend a hand to the promotion of PGD by Israeli parliament. Donor babies are another controversial topic in the ever-expanding field of genetics. As we continue to find out more about the intricate nature of our genetic makeup, we are met with new ethical, legal, and social questions. How will we choose to answer to those questions? We are a group of genetic students hoping to shed some light on this ever-pressing topic of donor babies. Thank you for watching our video. We hope you found this piece informative.